Hello. Are you frustrated because you want to overcome type 2 diabetes, but you haven't been able to make much progress? Do you want to be able to prevent getting type 2 diabetes? Are you struggling with the complications of diabetes, heart disease, strokes, blindness, kidney dialysis and transplantation, amputations, and even early death? Have you ever felt like you want to stop taking all those expensive, toxic medications? Do you wish you could just permanently reverse type 2 diabetes? Then you're going to want to pay very close attention to this presentation. My name is Dr. Ralph Harris, and I am a kidney specialist with a long research interest in type 2 diabetes. Then in 2006, I was asked to head up a team of experts to conduct a demonstration research project in the Marshall Islands in the South Pacific to show that we could prevent and reverse diabetes simply by helping them change their lifestyle, without expensive toxic medications or complicated surgical procedures. Those kind, gentle people had the highest prevalence of diabetes anywhere on the planet, 30%, and even higher as they grew older. Their hospital had been filled almost entirely with patients suffering and dying from the complications of the disease. They were desperate to try just about anything. Well, we got started, and within just a few months, we saw dramatic results in most of the patients. They had a significant improvement in their blood sugar levels. Their blood pressure levels came down. Their body weights returned toward normal. Their blood cholesterol levels improved. They were able to reduce and even stop their medications. They were able to avoid hospitalization for infections, surgery, and other complications of diabetes. They started living happy, healthy lives. Want to learn more about the studies from the people themselves in the Marshall Islands? Follow the link at the end of this presentation. Now, if you yourself ever felt you want to stop taking all those expensive toxic medications, and you want to have more energy and be able to do the things you used to do, but you don't seem to be making any progress to succeed with it, well, I can relate to you. You see, I am at risk too. I am from a family with similar medical problems. My mother died at the age of 66 years after many years of struggling with several health problems, such as you have. My youngest brother was only 45 when he was found cold and unresponsive in bed one morning from a fatal heart attack. He died, leaving his wife with several small children. Now he was overweight. He had high blood pressure. He also struggled with excessive alcohol drinking, and he smoked like a chimney. But it was said that he lived life to the full. But he died young because he did not look after his health. And then there was my other brother, 3 years younger than I was. He died at about 60 years of age after sustaining a massive stroke while attending our father's funeral, and he died soon after. He too was overweight. He loved to eat fatty foods, and he drank too much. He too ignored his health problems. He lived it up and ended up dying too soon. The problem is that we all had the same risk factors. We had a strong family history of hypertension and other risk factors for diabetes and its related disorders. Problems like our weight. But these were almost all factors we could control and treat, and even avoid by making simple changes in our lifestyle. The important thing is to be aware that it can happen to any one of us. And now, I'm on a mission to help spread the word and alert others to the need to know exactly how to prevent diabetes. I want to share some of what I learned and what I'm trying to do to avoid these problems. So, this is what I've decided to do. We have formed a group of experts to put together an incredible 6 to 9 months training program. We call it the Diabetes Prevention and Reversal Program. Now I want to warn you and make it clear this is not a magic potion, wonder drug, overnight snake oil cure. It's going to take 6 to 9 months. It requires a serious commitment. It demands a change in lifestyle, such as a nutritional diet and physical exercise. It includes willingness to be educated and understand the risk factors involved. Above all, it requires motivation. Again, it all starts with education. Anybody who is accepted into the program must be willing to learn and understand diabetes, its causes and its mechanisms of development, and what it takes to stop and reverse the disease. Above all, again, we require commitment and motivation. If you meet the criteria, you will continue with additional educational resources, which we will direct you to. Your application will then be considered and you will be enrolled in the private group. So go ahead and take the first step now. Oh, if you wish to learn more about the Diabetes Intervention Program in the Marshall Islands, use this link, http://vibranthealthtoday.info/diabetes intervention in the Marshall Islands. It will inspire you. Welcome, congratulations, and years to your long and healthy life. See you on the inside.